for supporting the link programming here. Appreciate it so much. And so, since it is a Fishy Friday, Good Friday, if you're into that kind of thing, you can check out Jack in the Box's fish sandwich and deluxe fish sandwich combo. It's panko crusted wild caught Alaskan pollock fish fillet. Grab one at your local Jack in the Box today. Mike, how was that? It was awesome. I've actually dabbled a little bit in the Jack in the Box fish sandwich. It's good. It's big and I had to do mouth stretches just to fit it in. Um, I almost had to put it in sideways. Yeah. What?
You already got a big mouth.
Oh wow. Thanks. I guess my Easter spanking came early. It's 9:01. Let's go into the Zoom room now where we have sitting by the administrator for Division of Environmental Health, Malou Scroggs, and also the public information officer for DPHSS, Janela Carrera. Good morning, ladies. Good Friday.
Happy Friday. Happy Good Friday. Good morning.
I guess we'll just start with Malou. Janela had sent over some of the more recent inspections that you guys have done. Do you care to kind of expand on that a little bit?
Um, you want the citation tickets or just the regular inspections?
We can start with the citations because you guys haven't stopped, right? Doing the nightly inspections for COVID violations.
Yes, Sabrina and Sabrina, we are regularly conducting regular inspection and COVID compliance inspections. And as of today, there are 13 citation tickets that were issued to businesses. It's not only health regulated establishment, but other kind of business. So far, there's one that already paid the fee, and two businesses didn't show up on their scheduled appearance at the court, and two contested. So one is already a hearing is already scheduled for one, which is on April 23rd. One is pending schedule, and there's two that's scheduled to appear yesterday, but we didn't hear from the court, so we're still following up on that.
Wow. And are you finding some of the people that you have, businesses that you've issued citations to, are they repeat offenders?
There's only one repeat offender, and that's the establishment that didn't show up on the court appearance at the scheduled date that they have to appear at the court. And so the traffic violation bureau will issue a notice to appear, but we haven't heard from them if it was already issued, and we're still following up on that.
And what are you finding, like a majority of the citations that you're issuing? What are the violations? Are they just not wearing masks or exceeding the capacity limits?
The most common violation that we're seeing is social distancing and not wearing face masks. That is the common violation that were cited of these 13 businesses.
And do you have like a breakdown? Are they mainly like bars and taverns, or are they restaurants?
1, 2, 3, 4, 5. There's 4 bars. 1, 2, 3, 4. There's 4 restaurants, 1 childcare, 1 funeral home. Let me correct that. On the bar, there's 7 bars.
Oh.
And 7 bars, 3 restaurants, one funeral home, and one childcare.
You said one childcare facility?
Yes. Yes, because of the childcare, children 2 years and above, they are required to wear a face mask.
Oh, so when inspectors went there, they saw children without the
Yes,
masks on.
correct.
Out of the 7 bars, were any of them repeat offenders?
There's one repeat. There's one bar that repeat violator,
I know when
and
we.
it's the same violation: social distancing and not wearing masks.
I remember when we had you on, was it last month? You were talking about having to pair the inspectors, male and female, because of when you respond. Sometimes the owners or the people that are there, they kind of give you guys a hard time. Are the inspectors still experiencing that?
Lately, so far, no. After our last interview with you guys, so far I didn't receive any complaint from our health inspectors.
And so you guys are still going out nightly?
Not nightly, because mostly bars doesn't open on Monday, Sunday, Monday, Tuesday, and that's when you don't see violation. Normally you see violation starting on Thursday, Friday, and Saturday. That's when we really go out. But if there are complaints, then we go out every night if there's complaint to address.
Are you guys, as we prepare for tourism or travel to reopen on May 1st, are you guys what are you guys doing to prepare for that? Because we'll probably see, more, I don't want to say more, a whole lot of people coming to Guam, because not a lot of people are traveling. But how are you guys preparing for that?
Okay, our role in that is we're tasked to review the COVID mitigation plan of those businesses that are applying for the Safe Travel certification and the World Trade Center stamp, something like that. So Visitors Bureau has been forwarding COVID mitigation plans of those businesses that applying for the certification, and we're doing the review of those plans. As of today, we received already 25. Of the 25, 19 were already approved, and 6 are pending revision and submission of their COVID mitigation plan.
Okay. Well, aside from the COVID inspections that you do, you still do these sanitary inspections. I wanted to follow up on what is the status of American Bakery? Have they since reopened?
Yes, they reopen. I just don't have the exact date, but they reopened. They met all they corrected all the violations that were cited during the closure.
Right. And what was the process? I think it was the inspectors have to go back like 2 or 3 separate times, right? To conduct
I think we went back 4 separate times, because the first follow-up, they said they were ready, but we still observe. That's when our health inspector saw a rat running across running across from the warewashing area. He even took a video of that.
Oh,
Then
can we get the video?
Then another follow-up, we still see signs of presence of pests, and also the report of the pest control company still indicated that there's still signs. So We didn't reopen them on those follow-ups. So on the fourth follow-up, that's when the, um, we feel that they corrected the pest infestation.
Man, Malou, I got to go back because you said that when your inspector went back to re-inspect the establishment, they saw a rat.
Correct.
Wow. Does that happen a lot? Because the rat, I mean, guys, if you see the rat, that means there's a lot of rats. Because the rat, it's very hard to see. You hear it, but they don't really come out and be like, hey, what's up?
And he was fast enough to take the video. I don't know how did he do it.
Yeah, that's what I'm saying. That rat was taking his time. Them rats was like comfortable. They're like, yeah, go ahead, get a selfie of me.
Especially during the daytime.
Yeah.
Yeah, that's what I'm saying. It's like, wow.
So you said 4 inspections. The first 2, there was evidence of the rats, rat, whatever. The third one, that's when things were okay, and then the fourth one, everything was good, right? So don't you have to have like back-to-back
Yeah,
inspections?
they also submitted 3 consecutive days a pest control report that it's not showing any more infestation or pests.
When did they reopen the bakery?
I just don't recall. I think they were closed for almost 3 weeks or 2 weeks. I,
Okay.
I just don't have the date with me, the report with me.
All right. Anything else, Malou, from environmental health?
We continued receiving complaints, and we've been addressing timely, and also we are continuing. We've been receiving a lot of requests of events. People, this organization, just like concert, and that's making us busy. The one that making us busy at this time is reviewing of businesses COVID mitigation plan, because we're already on peak or 3, and there's a lot of restrictions that were lifted and new requirements. So we've been going back to these businesses and require them to update and submit their business mitigation plan.
Malou, how do we have a concert?
Yeah. We can do concerts now?
We did not approve any.
Okay.
So what I
This
mean,
is an outdoor. This is an outdoor music concert that, but we didn't approve it. We haven't approved any events that is more than 25. Now it's 50. So
Okay.
but they're trying, right? So when they, when like for example, this outdoor concert, when they submit the plans to you guys, what is it about the plans they're submitting that is leading to the not being approved?
because the guidance is specific, Chris, that social gathering or congregation is only limited to 25. Now it's 50. So how could you have an event that is more than 50 and be approved by public health unless the governor will open up everything? Then
But
that's
what
the
about?
time they can.
Let me just ask you this. So the governor, lieutenant governor had a fundraiser, but they were able to entertain 23 guests at a time in different shifts, right? So what if I held a concert, but it was like 50 at a time, or, you know, because obviously it was very creative of them to have that fundraiser and work around the protocols. It was creative, let's just face it. So are we seeing any of that same creativity with these plans, or are they just saying we want to have a concert and it's going to be 1,000 people and approve it?
No, there's only one event that they I think that is the triathlon, that 25 on a certain time and another 25 on another time, but it's in the same day. But at first it was disapproved because it's about 50 participants. So later on they revised their event plan and lessen the number of participants to 25 in just like maybe first 30 minutes and then another 25 in another 30 minutes or an hour.
Malou, just to clarify, are you talking about plans that were submitted for the governor's reelection fundraiser?
I think she said trash.
Say that again.
I just wasn't clear. Were you talking about the plans submitted for the governor's reelection fundraiser, that it was 25 at a time every 30 minutes?
No.
Oh.
This is a sports event.
Okay, got it. So did the reelection committee have to submit plans to you guys for this fundraiser, or no?
Any event, they should have a COVID mitigation plan and submitted to public health.
So they did, the reelection committee.
I don't remember receiving one.
Okay.
All right. Thanks, Malou.
I hope we didn't get you in trouble there, Malou. Sorry. You know me. Anyway, let's just move along quickly then, Janela.
Yeah,
quickly, this never happened, guys.
Thanks, Malou.
Nothing to see here.
Moving along.
Yeah, Janela, I guess on the other side, so we got the DEH stuff. Are there other aspects of what public health has got going on that you want to share with us?
Sure. Yeah. So today we're at the Senahanya Gym. We have our village-based vaccination clinic going on today. We're offering up to 120 doses of the Pfizer vaccine, dose 1 and dose 2. And then next week, Monday, we're resuming our COVID-19 testing, our community testing. It's going to be at the old carnival grounds in Tees and Barrigada, and we're doing up to 150 tests. Just want to remind the community that if you are bringing your minor child, if you're a parent or legal guardian, you do have to make sure that there is identification for that child and that you're signing a consent form on behalf of that child. So that's just something new that we're implementing because, we've seen some people come in and we can't verify the identification of that child. So again, just want to encourage the community to come out. It's been a little slow at our village-based community vaccination clinics. And, we're not really sure what that is, whether it's because most of them are going to the UOG field house or there just hasn't been enough awareness about it. So just want to encourage the community. And then next week, Monday, we're at the Mongmong Totumaiti mayor's office for vaccination. And then on Tuesday, we're at Telefofo, and on next week, Friday, we're at the Asin Maina mayor's office for vaccination. This is for the village-based vaccination.
Is there
So that's our calendar.
any other special vaccination clinics that public health is going to be partnering or hosting for the FSM community?
Yeah, that's something we're planning right now. We're eyeing, and I don't. Well, yesterday we had one for the FSM community, but that was at GRMC, and that was for dose number 2. And this is for those who received dose number 1 on March 12th at GRMC. So there was one yesterday. And then for those who received it on March 28th, this past Sunday, we're looking at the possibility of having a dose number 2 clinic for them. But also I know that AMC is working in partnership with the FSM community. And so we're looking, so there's multiple plans going on right now. So we're looking at one of the target dates is possibly April 18th, but that's not finalized. That's just something that we're looking at as a possible date for the FSM community. And then we're also working with the Palau community, trying to see if there's something we can do for them as well. So definitely we've been in discussions with the FSM community, the Palau community, definitely want them to lead the project as well, be a co-leader in these events. But we're working with the AMC clinic this time, because they weren't part of the one on Sunday, this past Sunday. But AMC, GRMC, and of course Public Health, we really want to do something for our FSM brothers and sisters.
Any update on whether or not the April shipment of the vaccines have arrived?
Not yet. I did check to see if possibly our Johnson & Johnson vaccines have arrived, but so far we have not heard anything yet on the arrival of any of the vaccines. But we are looking at the potential of an increase of vaccines for the month of May. I just don't have the finalized number, but the good news is hopefully for the month of May, we will see more vaccines. So that's the good news. But today is Friday, so I'm definitely going to follow up to see, if we've received any of our vaccines for April.
Okay. By any chance, have they started the vaccinations of the inmate population, the detainees over at Department of Corrections?
Yeah, the last I checked, we were coordinating that, or GMH was coordinating that, because GMH is the contracted medical provider for DOC. So I know that they were already beginning the coordination for that for DOC. And it was supposed to be the GMH nurses that were going to be administering the doses, but I'll have to follow up to see if it's already begun. And that was late last week when I last heard of it. So I'm hoping that already sometime this week the process either has already started or they've begun scheduling it. So I'll have to follow up with our GMH contact to see if that's already started.
What about we asked you about this about a month ago, I think, about the isolation facility and moving it out of the hotel and into a smaller facility, or possibly even doing like a combination quarantine isolation facility.
Right.
What's the latest?
Right. So as of right now, we're still using Bayview, but what we did do is that the floors that were having concerns, and I think it was the third or fourth floor, we moved all the patients that were staying there up to I think it was the sixth floor. And so we're not using the third floor or the fourth floor, which is a floor where we were having reports or getting reports of ants and pests. So we closed off those rooms, and we're not using those rooms for patients. And so we moved them to floors where we know that there aren't any issues or concerns being reported. In the meantime, while we try to work on moving patients to the DUCIT. But that is still being worked on, and at this time, the patients are still being isolated at the Bayview.
And so when, if we achieve the path to half by May 1st, and people are getting the PCR test, the negative test pre-arrival, and there's no need to quarantine, what is the plan then for the DUCIT being used as a government quarantine facility? Are we still going to keep that in place and pay all this money for the facility?
That's a great question. And I think that's something that needs to be discussed as to what we'll do with the DUCIT or the government quarantine facility. I would think that maybe there may be some instances where we might still need a quarantine facility for those who may not meet the requirements of being able to quarantine or bypass quarantine. I don't know that DUCIT would be the facility. That's probably something that needs to be discussed, at the executive level. When we meet past to half, there may still be some individuals that may still need to be quarantined, depending on the situation, depending on whether or not they meet the PCR negative test. They may come in and not have a negative test on hand. So I think it really just depends on the discussion that needs to be made at the executive level.
Okay. And so, something also I just wanted to follow up with what Dr. Hoa Win has been talking to us about is the possibility that if you're fully vaccinated, you wouldn't need the negative PCR test, and you wouldn't need to quarantine at all. What are you hearing? Is that something that we might actually see be implemented after May 1st?
I have not been part of those discussions.
Okay.
With regards to CDC recommendations, my understanding is that when they made the recommendation that if you're fully vaccinated, there is no need to quarantine. It was a recommendation for fully vaccinated individuals not needing to quarantine, but it was not related to travel. So that was my understanding, unless something has changed since then. But with regards to what Dr. Wynn was saying, I'd probably have to listen back to it.
Okay.
But I'm not too familiar with what he was, talking about.
Okay. Anything else from public health? Anything you needed to get out to the public?
Yeah, I just want to. There's again Sinahanya today for our vaccination pod. MTM Mayor's office next Monday, Talofofo on Tuesday, and Assen next week Friday. But for COVID-19 testing, we're at the Teason Carnival Grounds next Monday, 9 to 12. So and of course our schedule is we issue out in the JIC release, but always look to our media partners. We rely on them to get the word out, just like KOAM. I know that you guys have always been, great partners in spreading the word out for us.
Thank
So
you for that,
very
Janela.
much.
Appreciate it.
Thanks, Janela. Thanks,
you, Malou.
Happy Easter.
Watch out for them rats. I'll see you.
Bye.
Happy Easter, Malou.
Thank you.
Okay. That's just crazy. I mean, to see the rat, first of all, that's a thing, because I've had issues with rats before. Not where, anyway, I don't want to get too into it. But to see it is one thing, but usually when you see it, it's like, oh, was that a rat?
Yeah.
You don't see it like it's posted up, oh, let me get out my phone and let me press record. You know what I mean?
And the rat's like, what's up?
Yeah, the rat's like, hey, what angle? No, I'm an up angle. Get me from the up angle. 9:29.
I'm glad we're going to, we segue from staying with the animal kingdom, so we're going from rats to talking about manta rays.
From rats to rays.
Yeah.
Right on. And so that's coming up next here with Jason Solis. It's 9:29. Good Friday, April 2nd. The show again brought to you by Jack in the Box. Curly fries. That's Lent friendly. There's never a bad time to enjoy Jack in the Box's newest $3 sauced and loaded curly fries with new slow-smoked bacon available in 2 flavors, triple cheddar and spicy pepper jack. Also brought to you by East West Rental.